Good afternoon. This is Ryan Williamson. Today we're going to talk about the issue of family presence during life-saving resuscitation events. Our case begins with a 45-year-old female who presents to the emergency department with complaints of left lower leg pain, constant chest pain that's exacerbated by breathing, shortness of breath, tachypnea, and difficulty speaking. Upon taking her vitals, she had a heart rate of 120 beats per minute, which is elevated from the norm, a blood pressure of 90/49, which is much lower than the norm, and an O2 percentage of 82. Upon physical exam, we found left lower leg edema that was tended to palpation, and the lab results came back revealing respiratory alkalosis, hypoxemia, elevated troponin-1, and Br natriuretic peptide. We then ordered EKG and imaging for this and found that there's a right bundle block, and upon a CT angiogram revealed bilateral pulmonary emboli. An echocardiogram was also ordered and showed right ventricular dysfunction. So all this evidence pointed to a diagnosis of deep vein thrombosis with bilateral pulmonary embolism. Now, thrombolytic therapy was ordered for this, but before we could administer it, the patient entered asystolic arrest. We immediately began resuscitation efforts and asked the family to leave. Unfortunately, there was no return of spontaneous circulation, but during the time we asked the patient's family to leave, one of our nurses asked, shouldn't they be allowed to stay? Now, there's not enough time to talk about, there was not enough time to talk about whether or not I agreed with that during this moment. We advised family to leave, we did what we could, and then unfortunately no resuscitation could happen, but it does lead us to talk about this question a little bit more in depth. Before we go into the ethics, let's talk about what's going on here. Deep vein thrombosis is a blood clot in the deep veins of the lower leg. Now, this usually happens in the valve pockets of big veins, and it causes a buildup of transmural pressure. This edema happens and it pushes out more fluid from the veins, and that's what's causing that tenderness she felt in her calf. Typically, these translocate and can get stuck in pulmonary arteries, so that is causing the other symptoms such as the decreased oxygen percentage. The increased heart rate is trying to make up for that, the decreased blood pressure, and oftentimes it causes right ventricular failure. We typically treat this with thrombolytics like low molecular weight heparin, but unfortunately 79 or rather 25% of cases of these typically lead to sudden death. So there's more than 100,000 of these annually, so it's a very prominent problem in the medical field. And about 79% of patients that have pulmonary embolism typically have a deep vein thrombosis as well, and that is the actual underlying cause for that embolism. So CPR has been around for the past 60 years or so, and really radically changed our approach to life-saving medicine. Studies have showed that 48.5% of those who we perform CPR on do achieve spontaneous return of circulation. But unfortunately, only 15.4% of those people ended up surviving to discharge. But other studies have shown that at hospitals, compressions are often delivered at rates lower than recommended. Now, the ethical dilemma here is whether or not the parents or the family should be able to stay during an event, or during a resuscitation event, rather. The important thing is that this question is not supposed to be asked during the resuscitation event. There's no time. I went with my gut. I asked the family to leave. But upon doing further research, we found that different studies have been performed that haven't decided to ask if the family wants to stay. And they also let them stay with a support staff person there. And 94% of them afterwards said they would do it again. 76% said that they adjusted better to the family member's death. And 64% thought that it was beneficial to the patient in their passing. The important thing here is the results show they did not interrupt the effort whatsoever. The provider said there was no interruption with their care. That's really key as well. But that's only as important as what the medical team thinks. So there's another study that asked how the nurses felt. And a study of 164 nurses showed that they potentially saw a few barriers, such as performance anxiety and fear of lawsuits. However, they did note the benefits of family members seeing that everything was done, and that I think this might help with closure. So the medical community is not entirely opposed, but education is going to have to happen if we want to move forward in this. Now, there's no formal Colorado laws on whether or not a patient's family has the right to be in there. Typically, they just defer to the advanced directives. Now, these are instructions that guide healthcare decision-making in the event that someone can't tell you. So typically, like a DNR, do not resuscitate, things like that. There's no clause for family presence during a resuscitation event. And however, there are statements made by two pretty big organizations, the American Heart Association and the American Association of Critical Care Nurses. Both have statements that say the family member should be given the opportunity to be in the room during a resuscitation event, but they do emphasize that a written protocol needs to be in place. And another recent study of the healthcare field showed that only 5% facilities have reported having this. But they also note that if a family member is disruptive, they're completely asked to leave. So it's a privilege. It's not a right. So if we're to move forward in this field, the biggest thing is just assess it case by case right now. I mean, I stand by my decision to ask family to leave, but upon further review of other research, I'd advise that if we are going to move forward in this direction, I think that's a great idea. You just need a written protocol. So I'd advise that this healthcare facility, this hospital, would take it upon themselves to, did that in writing and document it, offer training for the different staff, because there might be a little bit of pushback, considering that, my gut feeling is probably similar to what a lot of folks would feel about doing CPR, but it is important here that the data shows that if they don't interrupt, this really could be helpful for the families of our patients and maybe even the patients themselves. So definitely would advise training modules, things like that, to educate the staff. And other than that, I think that if we did something in writing, this would be a great way to move forward. But in terms of our case, I stand by asking the family to leave. So that's it. Thank you so much for your time. I appreciate everything. Have a good one. These are my references.